Today, we're diving into one of the most critical moments in medicine, the carefully choreographed, step-by-step process that makes sure a newborn's very first breath is a safe one. It's a moment that's absolutely packed with emotion. But underneath all of that, there's a precise, life-saving protocol unfolding. So what's really happening in that flurry of activity right after a baby is born? Well, the answer really revolves around a concept that medical teams call the golden minute. And trust me, that isn't just a poetic name. These first 60 seconds are, without a doubt, the most critical for a newborn, making that huge transition from the womb to the outside world. Every single action taken during this time is deliberate, and it's all designed to help that baby start breathing all on its own. So what's the very first step in this high-stakes protocol? You might be surprised to hear. It's waiting. Before almost anything else, the team hits pause for 30 to 60 seconds before clamping the umbilical cord. This little delay is so important. It lets the placenta give the baby one last surge of oxygen-rich blood, which really boosts their iron stores and helps ease that transition to breathing air. Okay, once that brief pause is over, the hands-on work begins immediately. And these next actions are universal. They happen for every single baby, every single time. They really form the bedrock of the entire resuscitation process. So we're still inside that first 30 seconds, and the team is moving fast. They place the baby in a warm, dry towel, making sure to cover the head to stop heat loss, and then they gently dry the skin. Now here's the brilliant part. This whole process is incredibly efficient because the very act of warming and drying is also providing that gentle nudge, that stimulation, needed to encourage those first big, crucial breaths. And of course, the protocol is smart enough to adapt for the most vulnerable. For premature babies born before 32 weeks who lose body heat way faster, the team adds extra warming measures, like using a special plastic wrap or even a bag, just to make sure their core temperature stays right where it needs to be. All right, so the baby is warm, dry, and stimulated. Now the team reaches its first major fork in the road. They have to do a super quick assessment to figure out if the newborn is doing well on its own or if it needs immediate help. Here's how they make that call. The team is looking for just a few key signs. A good, strong cry and regular breathing, those are fantastic indicators. Good muscle tone, if the baby is active, flexing their arms and legs, that all points to a healthy transition. On the flip side, a really weak cry, any sign of respiratory distress, like gasping, or poor muscle tone, where the baby just seems kind of limp, those are immediate signals that more support is needed right now. So, this quick checkup leads to two totally different paths. If you have a healthy, vigorous newborn, they're placed skin to skin with their mom to bond and stay warm. But for a baby who's showing any of those signs of distress, the team immediately moves them to a resuscitation warmer to start supporting their airway and breathing. From this moment forward, one vital sign becomes the guiding light for this whole process. It's the heart rate. The heart rate is the single most important indicator of how that newborn is doing, and it's going to dictate every single step the medical team takes next. The protocol really simplifies a complex situation into a super clear decision tree, and it's all based on that heart rate. So if the rate is above 100 beats per minute, great, the team just monitors. If it drops below 100, they start helping the baby breathe with a special bag valve mask or a BVM. But if that rate falls below 60, and that's a sign of critical distress, the team makes sure the breathing support is working perfectly and then starts chest compressions. Now, in those rare cases where these first steps aren't quite enough, the protocol has really clear guidelines for escalating care. These are the advanced interventions, and they're reserved for newborns who are in the most severe distress. Think about a medication like epinephrine. It is definitely not a first resort. It's only used if the heart rate stays critically low. We're talking below 60, after a full 30 seconds of effective breathing support and another whole minute of high-quality chest compressions with 100% oxygen. It's this really strict sequential process that makes sure every fundamental step is done perfectly before they even think about medication. And the guidelines are also super clear about what not to do, which is just as important. For example, the drug naloxone, which is used to reverse opioid effects in adults, is not given to newborns because it can actually cause seizures. So when you step back and you look at all these steps together, what might seem like a really chaotic, stressful emergency is actually a highly organized, calm, and methodical system. And that's really the ultimate goal here. From that first little pause to the most advanced interventions, every single action is part of a plan designed to turn a potential moment of crisis into a controlled, safe transition into the world. It's all about teamwork, precision, and giving every child the absolute best start possible. So, as we wrap this up, it kind of leaves you with a thought, doesn't it? The next time you think about the miracle of birth, just consider the incredible, often invisible science and skill that's at play. How many perfectly timed, unseen actions have to come together in just 60 seconds to make sure that very first breath is a safe one?